Well, September is National PAD Month. Of course, PAD stands for Peripheral Artery Disease. Joining us now is interventional cardiologist Dr. Ankur Lodha to discuss the disease and PAD Month. Hello, Dr. Lodha. Thanks for joining us this morning.
Hello. Good morning.
Well, appreciate you joining us. So what do folks need to know about this particular disease?
Well, PAD is a very common circulatory disease which is caused by narrowing of the arteries of your limbs. The narrowing is normally caused by clogging of your arteries with plaque, which is fatty deposits. And just like clogging of the arteries of the heart, it puts you at risk for heart attack, stroke, and limb loss.
So what are some preventative things that people can kind of do to potentially prevent this?
So people who are very, very high risk of peripheral arterial disease are the ones who have had a heart disease because they have 1 in 3 chance of developing PAD. Along with that, people who are smokers, diabetics, hyperlipidemia or high cholesterol, and family history of heart disease or family history of peripheral arterial disease is a high risk factor. So they need to contact their healthcare provider and see what risk factors could be controlled in this. Sometimes we may require to do certain interventions or procedures to remove the blockage from your arteries.
Now, with COVID in mind, and you work here in Lafayette, has there been any relation to PAD when it comes to potentially devastating COVID effects?
We have, in our clinical practice, noticed a very, very high rate of peripheral arterial disease and thrombus formation. And partly this is because of patients' failure to obtain medical care at the right time. And also because of preventative measures and medications has been an issue during the COVID-19 time. I really feel the patients need to be very aggressive, and so do healthcare providers in treating these patients.
Well, it's very important information. We appreciate you joining us this morning as September starts, as does PAD Month. Doctor, thank you so much, and hopefully we can talk to you soon.
Thank you very much.
All righty.
Well, as